As far as the AMA is concerned, we're not that surprised by these numbers. Obviously, there have been escalating pressures on general practice for a number of years, uh, largely arising from the fact that GP rebates were frozen between 2013 and 2020, and there's not really been sufficient catch-up. But I think it's fair to say that the Cleanbill analysis actually looks just at all consultations and for each patient that works through the door, the likelihood that they might be bulk billed. But I think you also have to consider the fact that the majority of consults are actually with people who are either over the age of 65 or under the age of 16. And for those people, the actual number of consults that have been bulk billed has actually increased. And so therefore about 77% of overall consultations have actually been bulk billed, and this represents perhaps a 1.7% increase over the past year. And we obviously are very much mindful that government has injected some further funds in 2023 into the system, about an extra $6 billion, including a tripling of the bulk billing incentive for those needy groups. And so while obviously we'd hope that the bulk billing rate could improve, we think there's certainly been some initial measures that have been successful in improving the amount of bulk billing for pensioners, concession card holders, and those under 16.
Okay, so it depends on age, and it also seems to depend on where you live, with bulk billing at 0% in Tasmania. Can you talk us through that aspect?
Well, again, that's sort of like a bit of a interesting statistic, because the overall number of services that have been bulk billed have actually increased in Tasmania from about, I think, 66% up to about 72 or 73% of all services. So there actually has been an increase, but that's again just been with those that have been in those concession card categories. Others, that is, those that are between 16 and 64 who don't fall into those categories, are finding it increasingly difficult to find a bulk billing doctor. And really that's largely because of the fact that the cost pressures on general practice have been escalating for a number of years. And it's obviously come to a head in recent times because of the inflationary-driven cost of living crisis that we're seeing, that of course has obviously also impacted very much upon general practice, whose rent, insurance, power bills, salaries, all these sorts of things have increased for them, and obviously those costs are now being passed on.
Are you confident, Julian, that Medicare, bulk billing, etc., will become an election issue and that things will improve for patients?
Well, I think, Ros, we're very much encouraged that the government wishes to talk about this, and we naturally hope that the opposition will as well, because we believe that there needs to be further investment in general practice, particularly around longer consultations, because we think improving the rebate reimbursement for GPs around longer consults that obviously deal with more complex issues, more difficult problems, and perhaps mental health issues, is really an important priority. And so I think that that's a very important focus for each party in the forthcoming election.
Are we storing up trouble for the future if people are putting off getting health issues addressed?
Absolutely. Ross, the trouble, of course, is that, people find the out-of-pocket costs too onerous and defer their medical care. Of course, that's only going to have increasing consequences later on, and therefore probably higher costs elsewhere in the system some months or years down the track. So clearly, primary care has been the cornerstone of the success of the Australian health system, and unless I think there's more commitment to general practice and a greater investment in general practice, and also increasing the general practice workforce, I think we're going to see, unfortunately, slipping in the global rankings of health services.
Julian Raitt, thank you.
It's a pleasure.